Hi everybody, my name is Tony Medina, founder of Soul Guide Medical, and it's been a long time since I've come to see a dermatologist. I've been very busy with my schedule and I don't think I've had a skin treatment in roughly over a year. During that time, I've experienced some, you can say, negative growth. If you look up over here, I'm gonna try to come in closely. There's all of these little, you can call them warts. It's like a virus that has been growing on my face. It's something that many people have, and my father has it, my brother has it, lots of older people have it. I guess I'm getting older. You can think of them even as age spots. So you can see that they start to grow and they become little bumps. And the doctor told me last year that I should get rid of them, but I was so busy with my schedule that I didn't get a chance. But now I finally have a little lull in my schedule and I think it's time to remove them. So I've done the scan of my face, and as you can see, there's a bit of a pore issue going on, but I'm not really going to focus on the pores today. I'm going to focus on removing my dots. And this analyzes my wrinkles. My wrinkles are actually in the normal area. You can see that in my age group, I fit right in the middle. So that part is going well. I don't expose myself to the sun too much, and I try to take care. This is in terms of pigmentation, and actually I'm not doing so badly. I'm actually below the average. You can see that I do have some pigmentation problem areas, but it's not so bad. So in terms of oil production, I'm again in the middle. Not too bad, and I used to be more oily, but I've been washing my face more. According to doctor recommendations, I wash my face every night before I go to bed and of course when I wake up, and I have a 10-step Korean skincare program at home. So my T-zone, my U-zone is right in the average. A little bit of an issue in terms of the moisture level and elasticity. Moisture levels at the top, I'm a little below average, and the elasticity is starting to go way down, and I can actually feel it. I can feel that my face is not as tight as before. It's been about 2 years since I've had any kind of face tightening procedure. So this is telling me it's time to have face tightening.
Before we continue, check out soulguidemedical.com for more information.
안녕하세요.
안녕하세요.
Originally, I thought that this was caused by a virus, but the doctor's saying that mine are more like skin tags and that they can be removed via a CO2 laser. I asked him if it's dangerous because my skin is darker, and he said no, the CO2 laser can remove this and it won't leave a permanent mark. This is a numbing cream. It's on for about 30 minutes. This bed is so warm. It's got an electronic blanket underneath. Okay, that was pretty interesting. In some parts it doesn't hurt very much, and then in some parts you can feel the sting a bit. If you have a lot like me, of course you're going to feel it more, but it's completely bearable. On a pain scale from 1 to 10, when I do feel something, I'd probably say it's like a 5. And in the other parts where I can't feel anything, it's not even a 1 because you just can't feel anything. Okay, so I just finished, and you can see that the doctor did he removed so many skin tags. The feeling was pleasant at some points and not very pleasant at other points. I made the mistake of not getting them removed when the doctor first recommended them, and then they grew, they expanded, and then I just had so many. I even got some in my hairline. I've seen the same thing on my brother and my father and other friends. You get them in your hairline as well. My advice to you is, if you even see one, go to the clinic and get it removed. One is not a problem. But having like 50 like I had, it tends to be a little bit unpleasant. It's not a good idea to go out into the sunlight after you've had this kind of treatment. So you can see that they're covered with bandages, and I'm also going to cover myself with a hat, and I'm not going to leave my house for a full day. Doctor says that they'll scab over in about 4 or 5 days, and then I should be okay. Always good to protect yourself from the sun so you don't get any hyperpigmentation. You can do this treatment even if you have darker skin like me. If you have lighter skin, it's even easier. These things scab over pretty easily, and the leftover mark is not so big. If you have darker skin like me, they scab over. There's a little bit of pigmentation issue, and then after some time it goes away. I've had this treatment before a few years ago, and I remember after about 10 days, 2 weeks, my skin grew back regularly. As long as you take care of yourself afterwards, you won't have any issues.